Good afternoon, professors. Today I want to deliver the persuasive speech, and for me, my topic is going to talk about the profession and what can we do to help improve the environment right now of nurses. I don't know. You must have like sometimes waiting anxiously at the hospital, hoping somebody could just rush to help you, right? Can you imagine that? Like you scan the busy hall, but there aren't enough nurses to answer a call. That's just that's just a nightmare. It's an unfolding reality for millions across our country. Right? By 2025, the United States will face a deficit of over 50,000 registered nurses. This crisis is driven by an aging population, nurses are going to keep retiring, and a painfully slow increase in new nursing graduation. More than 250,000 additional nurses are needed by 2030 just to keep up with the demand. Imagine, when you're most vulnerable, there simply just may not have enough skilled, compassionate professionals to care for you. This is not just a workforce problem, it's a threat for public health. It threatens every corner of the society, from from rural clinics to bustling city hospitals. Fewer nurses means longer waiting time, more stressed caregivers, more burnout teams, and mistakes that should never happen. Should never happen. Never. The pandemic made this even worse, exposing the strain on our healthcare system. But there is hope. Together, we can change it. So there is some solutions. So first, we must invest in nursing education, funding scholarships, expanding training programs, supporting new entrants, helps fill the pipeline and replace retiring nurses. Then, we must advocate for sensible hospital staffing policies that ensure safe nurse to patient ratios, so there's lower stress and better outcome. Third, we must recognize and encourage nurses in our communities, not just with applause, but with real action and respect. Just because of the benefit, when we support nurses, every one of us benefit, right? We can just build like a more healthier community, more vaccinations, faster recoveries, lower costs, and better long-term outcomes. Right? Alright. In fact, studies shows that well-staffed hospitals save thousands of lives every year. Every year. Reduce medical errors and help prevent the spread of disease. Innovations like telephone health and nurse practitioners serving remote areas are helping, but they need our backing to expand and succeed. Nurses aren't only on the front line, they're leading the healthcare frontward. Now, let's talk about what we can do as citizens. Supporting nurses scholarships and educational programs locally and nationally, or even write or call your representatives, urge them to champion nurses and healthcare workers, recognize nurses, not just during the National Nurses Week, but it's gonna take every week as National Nurses Week. Just don't wait for a crisis to show you how vital nurses are. Just don't let it happen. One day, you or you or someone you care will need a nurse. But what we do now would decide if help is actually there. Picture a future just where like hospitals have the teams they need, where nurses work with manageable loads, and where nobody is left waiting for care. But this future depends on us, on our voices, our advocacy, and our willingness to act. Nurses care for us in our most vulnerable moments, right? Now it's time for us to also care for them. Today, I'm just trying to urge you, step up, support nurses, support public health, and just help ensure we always have the care we need when it just matters the most. Thank you.